Welcome back, everyone. Today, we're going to be taking a deep dive into cerebral palsy.
Okay.
One of our listeners actually wrote in and said that they were really interested in this.
Okay.
And, I took a look at the materials and oh my gosh, we have a lot to cover.
Yeah.
We've got medical textbooks. We've got some, videos, even a personal story.
Wow.
So this is going to be a really fascinating deep dive, I think.
Yeah, it sounds like we've got a pretty comprehensive set of sources to work with. Cerebral palsy is such a multifaceted condition, so having all those different angles is really valuable.
Yeah. So maybe you could just start with the basics. What is cerebral palsy?
Yeah, definitely. I think the text that we have defines cerebral palsy as a range of nonspecific clinical symptoms characterized by abnormal motor pattern and postures caused by non-progressive abnormal brain function.
Okay, well, that's a mouthful.
Yeah, medical definitions can be a bit dense, right?
Yeah. So maybe we can unpack that a little bit. What stands out to you in that definition?
Well, I think the term non-progressive is really important for people to understand.
Okay.
That means that the brain injury itself doesn't get worse over time.
Oh, okay.
But the effects of that injury on a child's development can definitely change as they grow.
So it's not like the damage is expanding. It's just that how it affects them changes over time.
Exactly. Yeah, it's a good way to put it. Think of it like, if you have a house and the foundation has some cracks.
Right.
Those cracks might not necessarily get bigger, but how those cracks affect the rest of the house, the walls, the roof, that can definitely change over time.
Oh, I see. Yeah.
Yeah.
So the damage is kind of done, but how it kind of plays out can really change.
Exactly.
Wow. Okay. And this is a pretty common condition too, right?
It is, yeah. The source mentions that cerebral palsy is the most common movement disorder in childhood,
Oh, wow.
affecting about 2 out of every 1,000 births.
Wow. That's a lot of people.
It is, and it's even more common in premature and low birth weight infants, which kind of highlights just how delicate the brain is in those early stages.
Yeah. You really start to think about all the things that can go wrong.
Yeah, absolutely.
So let's get into the types of cerebral palsy because the materials here list a bunch of them and I'm already feeling a little overwhelmed.
Yeah, I know there are quite a few different categories, but they're important to understand because they help us tailor the treatment and the support that each child needs.
Okay.
So, let's start with the most common type, which is spastic cerebral palsy.
Okay.
This is characterized by increased muscle tone, so the muscles are kind of constantly contracted, leading to stiffness and difficulty with movement.
So they might have trouble walking or using their hands easily.
Yeah, exactly.
I see.
And what's interesting is that because it's so common, it can often be misdiagnosed as just clumsiness in those early years.
Oh, really?
Which can lead to a delay in getting the right help.
Wow. So early detection is so important.
Absolutely crucial.
Okay. So we have spastic cerebral palsy. There's also a term hemiplegia. I remember seeing that in the materials.
Yes. Hemiplegia means that only one side of the body is affected. Okay.
So you can imagine the challenges of coordinating your movements when one arm and leg are weaker or stiffer than the other.
Yeah, that sounds incredibly frustrating.
It is definitely a unique set of challenges.
And what about quadriplegia and diplegia?
Yeah, so quadriplegia means that all 4 limbs are affected, so that's obviously the most physically limiting type.
Oh gosh, yeah.
And diplegia primarily affects the legs.
Okay.
So children with diplegia often have difficulty walking.
So it seems like different areas of the brain are affected, which leads to these different movement challenges.
Exactly. It all comes down to which parts of the brain are injured.
But it's not always that straightforward, right? I mean, we have other types like dyskinetic CP and ataxic CP.
You're absolutely right. It's not always clear cut. With dyskinetic CP, the main issue is involuntary movements.
Oh.
So you might see a child whose arms are constantly jerking or twisting. It can be really difficult for them to control their movements.
Wow, that sounds really hard to live with.
It is a very challenging type of CP.
And what causes those uncontrolled movements? Well, it's all about the signals from the brain. In dyskinetic CP, the messages that tell the muscles to move or stay still get kind of scrambled. So instead of smooth, controlled movements, you get these involuntary actions.
Makes you realize just how complex the brain is.
It really does, yeah.
And then there's ataxic CP, right? Which affects balance and coordination.
That's right. This one affects the cerebellum, which is the part of the brain that controls balance and smooth movements.
Got it.
So imagine constantly feeling off balance, like you're on a boat in rough seas.
Yeah, that must be so disorienting.
It can be very challenging to navigate the world when you feel that way.
And then just to complicate things even more, there's mixed type where you see a combination of all these different symptoms.
Yeah, exactly. It just goes to show how complex and varied cerebral palsy can be. Each person's experience is unique, which is why personalized care is so important.
I see. So we've got all these different types of CP. And before we jump into treatment, I think we should probably talk about what causes this brain injury in the first place.
Definitely, that's the next piece of the puzzle, right? What causes cerebral palsy?
Yeah, what are some of the factors?
Well, the source mentions a whole range of things, from congenital malformations, which are problems that are present at birth, to events that can happen during pregnancy or delivery.
So it's not just genetics then?
Not at all. For example, hypoxia, which is a lack of oxygen to the brain, can happen during a difficult labor or delivery, and that can lead to brain injury.
Wow, so anything that disrupts the oxygen supply to the baby's brain.
Exactly. It's a critical factor. And prematurity is another huge risk factor because those tiny brains are just so vulnerable.
Yeah, I can imagine that anything that interrupts that normal development could have lasting consequences.
Absolutely. And what's interesting is that it's not just about what happens before or during birth. The source even lists things like motor vehicle accidents and child abuse, specifically shaken baby syndrome, as potential causes.
So the developing brain is vulnerable even after birth.
Exactly. It's a sobering reminder that we need to protect those little ones.
Yeah. And, I think a lot of people probably assume that cerebral palsy is only present from birth.
It's a common misconception, but knowing that events later in infancy can also cause CP makes us realize just how crucial those early months and years are for brain health.
Okay, so we've got this complex interplay of factors that can lead to cerebral palsy. And we've talked about the different ways it can manifest. So I guess the next question is, what can be done about it? What does treatment look like?
That's a great question, and that's exactly what we'll dive into next, the different approaches to managing cerebral palsy.
All right, so we're ready to tackle the next piece of the puzzle.
We are, and it's a piece that involves a whole team of people, not just medical professionals, but families as well. So we've been talking about, the different types of cerebral palsy and what causes it.
Right.
But now let's get into, what can actually be done? How do you manage CP?
Yeah, that's a good question. What happens after that initial diagnosis? What does treatment look like?
Well, it's really a team effort. You've got physicians, you've got neurologists, therapists, and of course the parents all working together.
Right.
And the approaches themselves can be categorized as preventative, symptomatic, and supportive.
Okay. So preventative measures would be like trying to reduce the risk of CP in the first place.
Exactly. Things like good prenatal care. Making sure that moms are healthy during pregnancy.
Right.
And then also careful monitoring during labor and delivery to prevent oxygen deprivation.
Okay, so making sure the baby's getting enough oxygen.
Exactly. Those are key preventative measures.
Got it. And then symptomatic treatments would be aimed at managing the specific symptoms of CP, like the muscle stiffness or the difficulty with movement.
Right. That's where things like physical therapy, occupational therapy, and speech therapy come in.
Okay, so each therapy is kind of targeting a different aspect of CP.
Yeah, exactly. Physical therapy helps with mobility. Occupational therapy focuses on those daily living skills, like getting dressed or eating.
Right.
And speech therapy addresses those communication challenges that some kids with CP might face.
So it's really a multi-pronged approach.
It is. It's about addressing all those different needs.
And then there's the supportive side of things.
Right. Supportive care is all about creating an environment where the child can thrive.
Okay.
So that might involve things like assistive devices, educational support, and of course, emotional support for both the child and their family.
It sounds like it's really about looking at the whole child, not just the physical symptoms.
Absolutely.
Yeah.
It's about maximizing their potential and helping them live their best life possible.
That's great. Now, the source also mentions some specific medical interventions, like medications and surgeries.
Yeah, those can be part of the treatment plan, too.
Can you talk a little bit more about those?
Sure. So medications are often used to help manage spasticity, which is that muscle tightness we talked about earlier.
Okay.
Some common medications actually work by blocking the nerve signals that cause those muscles to contract.
So it's like interrupting the message that's telling the muscles to stay tense.
Yeah, that's a great way to put it. And it can really help to reduce stiffness and improve mobility.
Interesting. And then surgeries, are those for correcting those contractures that we talked about?
Exactly. Contractures are those shortened muscles or tendons that can restrict movement. So surgery might be an option to help lengthen those tissues and improve range of motion.
Those surgeries sound pretty intense, though.
They can be, and they're not always appropriate for every child.
Right.
The decision to do surgery is made on a case-by-case basis, carefully weighing the potential benefits and risks.
So it's not a one-size-fits-all approach.
Not at all. Every child is different, and their treatment plan needs to be tailored to their specific needs.
I see. And it sounds like these medical interventions are just one piece of the puzzle.
Exactly. They're often used in conjunction with those therapies and supportive measures we talked about earlier.
So it's all about finding the right combination of approaches.
Absolutely. It's about creating that individualized plan that's going to help the child thrive.
Now, the source also talks about the role of nurses in caring for children with CP.
Yeah, nurses are essential members of the care team.
What are some of the things that nurses focus on?
Well, they play a vital role in promoting mobility,
Right.
helping those kids move around as much as possible.
Okay.
They also focus on nutrition, making sure those kids are getting the nutrients they need to grow and develop. And of course, they provide a lot of emotional support, both to the child and to the family.
So it's not just about the medical care. It's about that holistic approach again.
Exactly. Nurses are often the ones who are really connecting with the families, educating them about how to provide care at home, and helping them navigate the challenges of raising a child with CP.
So they're like a bridge between the hospital and the home.
Exactly. They play a crucial role in ensuring that families have the knowledge and the support they need.
It sounds like they really make a huge difference in the lives of these kids and families.
They absolutely do.
Okay, so we've covered a lot of ground here, but I think it's time to put our knowledge to the test.
Okay, I like a challenge.
All right, so let's look at those multiple choice questions from the text.
All right, let's do it.
The first question asks, an 8-year-old with CP is admitted to the hospital for a tendon lengthening procedure. After surgery, the parents ask a nurse why their child must wear braces and shoes for at least 12 hours, even while in bed. How should the nurse respond?
That's a good one. So we're thinking about why those braces are so important right after surgery.
Yeah, what do you think?
Well, I mean, thinking back to what we discussed about contractures, if the surgery was to lengthen the tendons, those braces are probably crucial for maintaining that new length.
Right, so it's about preventing the tendons from shortening again while they're healing.
Exactly. It's all about maintaining proper alignment and supporting those newly lengthened tendons.
Okay, so let's look at the answer choices. One option says it's to encourage ambulation as soon as possible.
I mean, getting moving is important, but I don't think that's the top priority right after surgery.
Yeah, probably not. Another option says it's for stretching ligaments and strengthening muscles.
Well, that's usually achieved through specific therapies and exercises, not just by wearing braces.
Right, and then there's one that says it's to help the child accept the physical constraints of the condition.
That doesn't really seem relevant to the purpose of the braces.
No.
Huh.
So it really does seem like the main reason is to maintain that body alignment and support those tendons.
Exactly. That's the most accurate answer.
Okay, next question. What safety precautions should a nurse teach a child with diminished sensation in the legs because of CP?
Okay, so this is about safety, which is obviously crucial for all kids, but especially those with sensory impairments.
Right.
So one option says testing water temperature before bathing.
That seems like a basic but essential precaution since the child might not be able to feel if the water's too hot.
Absolutely. It's all about preventing burns. Another option says tightening brace straps securely before walking.
Well, secure straps are important, but I could see how over-tightening could cause problems.
You're right. It could restrict blood flow or even cause sores. So that's not the best advice. And then there's setting an alarm to change positions during the night.
That seems more relevant to preventing pressure sores, not specifically for diminished sensation.
Yeah, it's not directly addressing the sensory issue. And the last option, looking down at the legs while using crutches, is a recipe for disaster.
Yeah, you need to be looking ahead to stay balanced and avoid obstacles.
Exactly. So the big answer here is definitely testing that water temperature.
All right, last question. When planning long-term care for a child with CP, it is important for the nurse to consider that the nays.
Okay, so this is about the bigger picture, thinking about the long-term implications of CP.
Right. One option says the illness is not progressively degenerative.
This takes us back to our discussion about the non-progressive nature of CP.
Right. The brain injury itself doesn't get worse.
Exactly. But the effects can change over time. So that's an important consideration for long-term care.
What about the option that says the effects of CP are unpredictable?
Well, while individual journeys can vary, the effects are generally predictable based on the type and severity of the brain injury.
So there's still a framework for understanding how CP might progress.
Yeah, we're not just throwing darts in the dark. Another option says that the child probably has some degree of mental retardation. That's a tricky one. While intellectual disabilities can occur with CP, they're not a given.
Right.
It's important to assess each child's cognitive abilities individually and avoid making assumptions.
Okay, and the last option says genetic counseling before family planning.
Well, genetics can play a role in some cases, but it's not the only cause. As we discussed, many cases are related to events during pregnancy, labor, or after birth.
So genetic counseling might not be the top priority for every family.
Exactly. It depends on the individual circumstances. So I think the most accurate and relevant answer here is that the illness is not progressively degenerative.
Okay, that makes sense. So those multiple choice questions really help to kind of solidify some of these key concepts.
Yeah, they're a good way to apply what we've learned.
But I'm really curious to hear about those real life examples you mentioned earlier.
Yeah.
Hearing personal stories always helps me to connect with the human side of these conditions.
I totally agree. Stories have a way of bringing these concepts to life and reminding us that behind every diagnosis, there's a unique individual with their own strengths and challenges and dreams. We've been talking a lot about the challenges of cerebral palsy,
Yeah.
but I think it's important to highlight the progress that's been made, especially in terms of technology.
Oh, yeah, definitely. Technology is really changing the game for a lot of people with CP.
It's amazing to see how it's breaking down barriers and giving people more independence.
Absolutely. So what kind of technologies are we talking about here?
Well, mobility aids have come a long way.
Right.
Walkers, crutches, wheelchairs, they're all getting lighter, more adaptable, even customizable to meet individual needs.
I've seen those wheelchairs that can climb stairs. It's incredible.
It's really impressive how far they've come. And it's not just about wheelchairs, Communication devices are also huge for people with speech impairments.
Yeah, those are so important. I'm really fascinated by those, actually, because it's like you're giving someone a voice.
Exactly.
Yeah.
And the technology is getting so advanced, we have speech-generating devices that use eye tracking or even brain-computer interfaces.
Wow, so you can literally communicate using your thoughts.
It's pretty mind-blowing. And the devices are getting more user-friendly all the time.
That's amazing. And what about things like computers? Are there adaptive technologies for people with CP to use computers?
Oh, absolutely. There are specialized keyboards, mice, software, all designed to make computers accessible for people with motor impairments.
So they can access the internet, education, all sorts of things.
Exactly. It's about opening up those opportunities that might have been out of reach before.
And what about smart home technology? I feel like that could be really helpful for people with CP.
Oh, definitely. Think about being able to control your lights, temperature, appliances, even security systems, just using your voice.
That would make such a difference in terms of independence and safety.
It really would. It can make a home so much more accessible and user-friendly for someone with CP.
It's incredible to think how technology can impact even the simplest things in life.
It really is. It's all about empowering people to live their lives to the fullest.
But with all these advancements, are there any challenges or limitations that we need to be aware of?
Yeah, definitely. Access is a big one.
Okay.
Assistive devices can be expensive, and insurance coverage can be spotty. So not everyone has equal access to these technologies.
That's a really important point. Technology is great, but it's not a magic solution if people can't afford it.
Exactly. And then there's the issue of user-friendliness.
Right.
Some of these devices can be pretty complex and require training. So it's important to make sure that people have the support they need to learn how to use them effectively.
And technology is constantly evolving, too.
It is. So keeping up with those changes can be another challenge.
So it sounds like we need a really collaborative effort to make sure that these technologies are reaching the people who need them.
Absolutely.
Yeah.
It takes healthcare providers, educators, technology developers, even policymakers all working together.
And I think it's important to address the stigma, too.
Oh, definitely.
Some people might feel self-conscious about using assistive devices.
Right. They might see it as a sign of weakness or something.
Yeah, we need to change that perception and see these devices as tools that empower people.
Exactly. They're not something to be ashamed of. They're something to be celebrated.
Well said.
Yeah.
I think this has been a really incredible deep dive.
It has. We've covered a lot of ground.
We've learned so much about cerebral palsy, the different types, the causes, the treatments, the technology. It's really been eye-opening.
Yeah, and I think the biggest takeaway for me is that while cerebral palsy presents some unique challenges, it doesn't define a person's life.
That's so true.
With the right support and resources, people with CP can achieve amazing things.
Absolutely. And I think that's a message we all need to hear.
Definitely.
Well, thank you so much for joining us on this deep dive into cerebral palsy. We hope you found it informative and inspiring.
Thanks for having me.
And to our listeners out there, keep learning, keep exploring, and keep advocating for a more inclusive world for everyone.